Okay, for this lecture, we're going to talk about Parkinson's disease. Is Parkinson's disease revisited? We're going to go through some pathophysiology and what you can do to minimize your risk of getting the disease and improve, hopefully, your function while you've got the disease. So here's a picture of the brain from the sagittal view. That's if you cleave the brain down the midline there. And this is the three-part brain concept. Three-part brain concept of McLean, neuroanatomist at Harvard. So part one is the brainstem. This is the brainstem right here. And the brainstem is like called reptile brain. And that's just simple functions to keep you alive. Your heart beating, your blood pressure maintained. A reptile doesn't need to do much. It lays its eggs and it can walk away. Okay, next part of the brain we've got colored in here in orange. This is the limbic part of the brain. Limbic means ridge because it's the medial ridge of the brain, and it's really called the mammal brain. These things started to show up more in mammal anatomy, and they were very tightly close to having a family. Big difference between a mammal and a reptile is a mammal nurses its young, takes care of them, and a mammal has a lot of instinctual behaviors. So that's mammal brain, all right? And then the third part of the brain is out here is cerebral cortex. Cortex means bark, like the bark of a tree, and that's our primate human brain. And the point about the cortex is it's more thoughtful, it's more able to delay gratification, more able to pursue a long-term goal, more capable of abstract thought. The more anterior you go in the brain, the more abstract the thought gets. That's why the frontal lobes are so important. And this also brings up the concept of thinking fast and thinking slow, which was a famous book. The author won a Nobel Prize. But the point of it that I'm making is the mammal brain's fast and instinctual, whereas the cerebral cortical brain, primate brain, human brain is more thoughtful. And so basically how that relates to your own personal life, if you're in a fuss with your significant other, sometimes you want to just sleep on it, or sometimes, know which phase you're in. So if you want to make a thoughtful statement, wait till you're in a cortical phase rather than an emotional, stressed out phase in the mammal limbic brain. All right, well, anyways, what's the point of all this? Here's the midbrain, the top of the brainstem. So here's midbrain, here's the pons, here's the medulla. From the midbrain, we take it over here with a transverse section, and here's what the midbrain looks like. The substantia nigra. Substantia just means stuff that's black, okay? That is the substantia nigra, and that contains the highest concentration of dopamine neurons, and it relates to Parkinson's disease. Normal substantia nigra, when you look at it on a brain MRI, susceptibility weighted sequence, you'll see that there's a forked tail at the bottom, and that's called the swallowtail appearance of the substantia nigra. When it's all blunted and rounded off, that is loss of the swallowtail sign, an indicator of Parkinson's disease. But there's really more than one type of Parkinson's disease, and there's other tests that one can do. But I'm just letting you know that's kind of what it comes down to on MRI. Okay, we're going to go into a lot more stuff than that. That's just a warm-up. Okay, Parkinson's disease is a movement disorder that eventually becomes a cognitive disorder leading to dementia. First described in 1817, and it's hardly ever genetic. There's some genetic forms, but you remember we've talked about that before. Don't think genetic. That's a last resort. The Parkinson's disease, substantia nigra, loss of dopamine neurons. They communicate with sort of the basal ganglia area. It's another disease associated with industrialization. Wasn't widely around before 1817. And it fits the global distribution for autoimmune disease. You just type in a computer, global distribution of Parkinson's disease, and you'll see it fits a largely northern distribution, characteristic of industrialized societies, where there's a lot of air pollution, where they eat a lot of meat and dairy, don't get a lot of sunshine. Farm with a lot of herbicides and pesticides in the modern world. The distribution for autoimmune disease is very similar to that for leaky gut. And then there's the Braak hypothesis of Parkinson's causation. So Braak was a pathologist who saw a pattern of Lewy bodies accumulation. Lewy bodies are what you see at autopsy on a slide of the brain, and it contained a lot of misfolded proteins called alpha-synucleins. All right. So that's the classic protein accumulation with Parkinson's. And when I was a med student, we had to memorize protein accumulations for Alzheimer's and for Parkinson's. Okay, and then Braak claims that in his autopsy patients that the pattern spread from the gut to the brainstem up into the higher parts of the brain, and that patients who had vagotomy surgeries, cutting the vagal nerve, let's say for a gastrectomy for peptic ulcer disease in the past, would have a lower incidence of Parkinson's. So this led to the Braak hypothesis that somehow the Parkinson's spreads maybe by leaky gut, maybe by infection up the vagal nerve to the brain. Okay, but now if you read this guy Alberto Espay, I'm going to tell you about Alberto Espay. I like him. He's a real clever guy. He's got a bunch of videos. Here's his book. It's a very clever book. His videos are clever. But he's a bread and butter clinical neurologist. And what I mean by that is he's very smart, and he basically looked quite closely at all the research on Parkinson. And here's what Espay says. He says, Braak hypothesis is bogus. A closer look at the autopsies, it doesn't really routinely follow that pattern. Now, don't get me wrong. Parkinson's is more than one thing. There's multiple different causes of Parkinson's. So maybe some patients do follow Braak's, but it's certainly nowhere near being a universal thing. And Espay points that out in his book. Okay? All right. You always want to try to figure out what's causing a disease because that gives you the best chance to remove the cause and cure the disease. Okay, most of the time people never figure out what the cause is and they just take a pill that doesn't work and they have crappy outcomes. That is the most common thing that happens. So you don't want that to happen to you or someone you know. All right, but they got to learn this stuff here. Okay, standard hype cycle, by the way, in medicine. You're going to see this all the time, so you should know it. Something gets hyped up. There's an exaggerated claim. Then the next thing is there's an exaggerated rebuttal. Then the claim gets adjusted. Then the rebuttal gets adjusted. And you usually end up with some conventional standard position. And guess what? The standard position is usually quite often still wrong. And then there'll be a few really smart people who kind of know the truth, who figured it out. You know, somebody like Dr. McDougall in nutrition or something, all right? But a lot of times, the truth is not widely known. Okay, look at coronary artery disease. You know, anybody who studied nutrition knows you can prevent it, reverse it easily with diet. But what does a typical chump do? A typical person spends tons of money on it, open heart surgery, stents. Come on. For routine outpatient coronary artery disease, the smart move is diet. Okay, it's obvious. All right, Alberto Espay, with his Parkinson cases, he makes it real clear in his opinion, it is not a prion disease, meaning spread by a protein. It's not a standard proteinopathy of any type, according to Espay. I wrote the page numbers from this book if anybody's interested in this. Like, let's say you're taking care of a relative or yourself. So Espay's book, well worth reading. His lectures are well worth watching, but I still see a weakness in Espay. You don't know what the weakness is in Espay? He's a neurologist involved in doing clinical research on Parkinson's. He still has this mentality, we must find the drug. As if the only way to treat a disease is a drug. As if the only thing that causes a disease is a genetic vulnerability. You know, it's a very 1900s mentality, and it doesn't work that often. Okay, Parkinson's disease, they've got Lewy bodies in the brain at autopsy. Okay, great, that's the definition. But guess what? Alzheimer's patients routinely have Parkinson criteria, accumulation of Lewy bodies as well. And then he goes through more autopsy results. This is all coming from Espay. I wrote the page numbers again. It's because this is great. What he's basically saying is autopsy diagnosis of Parkinson's and Alzheimer's is to a large extent a joke, okay? Patients tend to have both diseases. Normal people who have no cognition problems at all will sometimes meet criteria for these diseases, okay? So if the criteria don't distinguish which patient has what, then the criteria are not that useful. Parkinson's patients often have beta amyloid protein at their autopsy, about 80% of them, with or without dementia. The patients with the most beta amyloid and tau neurofibrillary tangles, classic lesions of Alzheimer's, they lived longer. So what Espay is saying is maybe they're not causing the disease. Yeah, obviously. Maybe they're even something protective. Okay, that's also a sign of intelligence. When you're looking at something complex, always say, what if the opposite could be true? What if the opposite could be true? Because you'll turn out that happens all the time, that ends up being right. Not always, but a lot, often enough that you should always consider it. Okay, also, some people are demented and seem to have Alzheimer's or something, but they don't got any of these findings at their brains at autopsy. Okay, maybe these things are kind of just tombstones. They're part of the like an immune response to preventing problems. So we are gone beyond the beta amyloid hypothesis, beyond the proteinopathy hypothesis, beyond the alpha-synuclein hypothesis. Good, it's about time. Okay, leaky gut, Braak hypothesis. You avoid that by avoiding things that cause leaky gut. Obviously, dairy is terrible, and maybe even the galactose reactions whereby a person could have the lactase enzyme in the gut but not have galactose metabolism enzymes and get all kinds of problems from galactose. We know galactose is associated with increased risk of, and it doesn't like round things, increased risk of ovarian cancer, increased problems with the testicles, and increased problems with the eyes, cataracts, for example. So dairy is much worse than people widely recognize. Obesity is associated with increased risk of Parkinson's. Oh yeah, guess what? The Substantia nigra dopamine cells, they've got glucose type 4 transporters. So that means they're vulnerable to insulin resistance. Okay, and we're going to talk about those neurons, the dopamine neurons. They're rather incredible neurons, and they really can't afford to be short on glucose. It's a big problem for them. Okay, Substantia nigra has glucose type 4 transporters for glucose, therefore it's vulnerable, starving in the midst of planning. What that means is big fat diabetic can eat a big meal, but the brain neurons are screwed because they cannot metabolize the fat. Beta oxidation, for multiple reasons, I just talked about that in a previous lecture, is not metabolized by brain neurons in any significant amount because it requires a lot more glucose. It needs a lot more, it requires a lot more oxygen because you got to oxidize it. A sugar molecule like glucose already got a hydroxyl group on every carbon. Versus, you look at a fatty acid, you got all those carbons with nothing but hydrogens on them. They all got to be, every other one's got to be oxidized for beta oxidation to burn those fats. So where's that oxygen going to come from in a brain that's barely getting enough oxygen as it is at baseline? Iron accumulation associated with increased oxidative stress might be associated with increased risk of Parkinson's. Maybe if somebody's iron level's high, they should consider donating some blood, get that ferritin level down. Mitochondrial toxins like rotenone, MPTP, paraquat heptachlor. Mitochondria is where the ATP come from. So, like so many other diseases, you lose the mitochondria, the cell can't make enough energy. It's an energy crisis for the cell. Michael J. Fox was diagnosed with Parkinson's when he was only 29 years of age. Therefore, it's not atherosclerosis. He wouldn't have had enough atherosclerosis at that young of an age. And there were a cluster of patients in Canada around the time that he got it, and so maybe it was some type of chemical exposure. Maybe they were next to a farm spraying tons and tons and tons of those pesticides when he was out there, living out there. Okay, vegan diet associated with decreased risk of Parkinson's. Well, for a lot of reasons. You're going to get a lot less pesticide exposure. You're going to get a lot better blood flow to the brain. Okay, always filter your water, at least a carbon filter. Stress reduces neurogenesis. So neurogenesis is the formation of new neurons. So manage your stress because if you have excessive stress, it's hard to form new neurons. Exercise produces new mitochondria. And this is a big one. When you exercise, you're going to make new mitochondria, energy production centers in your cells. And you're also going to make new neurons. And that's what the Substantia nigra needs. It needs new neurons. Parkinson's patients should exercise as much as they can. And Pamela Quinn's this lady, sort of like dancer, ballerina lady with Parkinson's who's got good advice for advising Parkinson's patients about exercise. She's got all her little tricks. Healthy diet and environment promote better neurogenesis. Okay, here's one article. Plant food diet and motor performance of Parkinson's. Basically, the plant-based diet, they improve their performance. So to me, it's obvious. You want to improve blood supply. You're running out of neurons in your Substantia nigra. You cannot mess around or you're screwed. You want to optimize blood supply to those neurons by eating the perfect diet. We talked about it, low fat, low sodium, vegan, 100% plant-based, 100% organic. And you want to exercise as much as you can. That's how you maintain and build neurons. The brain's more for movement than it is for exercise. Okay, here's another article. Evidence for neurogenesis in the adult mammalian Substantia nigra. So these are extraordinary things, I'm telling you, by the way. If you're really interested in Parkinson's disease, these are big things. That you can form new neurons in the Substantia nigra. That's incredibly good news. Because their problem is, typically they're not diagnosed until they lost 70% of the neurons in the Substantia nigra. So they got to maintain whatever neuron they can to maintain function. Otherwise, they become really debilitated, even going for brain surgery. They become unresponsive to the medication, L-Dopa. Okay, so this is good news. And also, here's some things about the brain. There's about 100 billion neurons in the brain, and only about 400,000 of them are dopamine neurons. And now listen to this on these neurons. Each one has about 2 million mitochondria. That's incredible, 2 million mitochondria per neuron. So that neuron really is going to need tons and tons of energy, okay? So you want perfect blood flow to the midbrain, all right? You want nothing that's going to damage blood supply there. So you want to minimize your fat intake as much as possible. You want to minimize your sodium intake so you're not vasoconstricted. You want to minimize your fat intake so you don't have, number one, insulin resistance, which is going to deprive those neurons of glucose. Number two, that fat is going to cause rouleau formation and blood sludge effects, dropping PO2 delivery about 15 to 20% to those neurons. So that's a disaster. You can't afford that if you've got Parkinson's. So it really does matter. So what other things have been found? Oh, in this paper, they saw that new Substantia nigra dopamine neurons were produced under physiologic conditions. This is great news. Do you hear what I'm telling you, Parkinson's patients? You can improve blood supply to your Substantia nigra with your diet. Number 2, you can exercise to build new neurons. That's incredibly good news. That should give you hope. There's a lot of people who've done well with their exercise, with their diet. You put the two together, you got an even better chance. They found that in the dentate gyres, now that's part of the hippocampus, but the mice were producing 10,000 neurons a day. That's incredible. 10,000 neurons a day. All right, that's a good number. And to learn anything, hippocampus now is learning center. I'm moving away from Substantia nigra for a moment here, just to sort of show what neurogenesis can do. Anytime you learn something new, you associate it with stuff you already know. You compare it to something you already know. All our judgment, all our learning is comparative and associative. That's how we learn stuff. Okay, and forming new neurons, they integrate themselves into the neural network, and that's part of it. Okay, now getting back to Substantia nigra. The neurons were arising from stem cells in the posterior part of the midbrain, like I showed you that picture of the first slide, and they come from the back and they work their way up into the Substantia nigra. So in the back is where the aqueduct of Sylvius is. That's where the cerebrospinal fluid flows through the back of the midbrain. And so that's where the stem cells are. All right? And now the mice were only producing about 20 stem cells a day, which isn't a whole heck of a lot, but you know what? It's a lot better than nothing. And they were integrating into the neural networks. So now what they're trying to do in humans is transplant them. And they're doing that in animal research. Well, they want to transplant them in humans. They are transplanting them in animal studies, but who knows if that's ever going to work. Obviously you can exercise today and potentially build some new neurons in your Substantia nigra. You can fix your diet today and improve blood flow to your midbrain. You can prevent insulin resistance so you can get more glucose into the cells that need it in the Substantia nigra. The neurons burn glucose. That's what they do. Okay. Let's see. Oh, here's just another article talking about the transplant. And like I said, the transplant's a little too much. That's not ready to go. But exercise, you can do that today. Beyond the hippocampus, adult neurogenesis throughout the brain. So neurogenesis is becoming more widely present in the brain than was previously recognized. Okay, some stuff I don't agree with. You're going to hear about Parkinson's. Some people say, oh, smoking tobacco decreases Parkinson's. That's kind of like saying, using heroin makes you skinny because all these drug addicts are skinny. If you spend your day passed out, maybe you won't eat so much. That's BS. Okay, I look at chest CAT scans. I've seen thousands of them. All these smokers, their lungs are all chewed up like Swiss cheese. They're terrible. Smoking is a terrible thing. And we talked about this before. Women, it's like make yourself get aged super fast. I know women in their 20s look like they're in their 50s from smoking so much. It's not good. Then the other thing is, caffeine, BS. Come on, you need to sleep, all right? If you're drinking all this caffeine, you can't sleep. And you're going to be ramping up metabolic demand. So you got these neurons that are starving, and you're going to ramp up their metabolic demand. I think that's stupid. Don't believe everything you read. If something doesn't have a plausible, physiologic mechanism, you should not believe it. And if something's going to hurt you in a big other way, like smoking tobacco, caffeine, or drinking tea, don't do it. That's my advice. That's what I would do. I can't tell you what to do. You have to decide for yourself. But I'm just saying, tea is one of the most overrated things. It's like it's cool to say tea is good for you. It concentrates F- and a couple other toxic things. I wouldn't ever touch this stuff. Okay, why is treatment approach only pharmacology? So that's what I said is a weakness of Espay. He just says, we got to subclassify all these patients, and then we'll do clinical trials, and then we'll find the best pharmaceuticals. Okay, well, maybe. He might have a point. That might be the way to do it. He's a pretty smart guy. It's impressive to hear him talk. But he doesn't know anything about nutrition. He never once brings the subject up. And that happens all the time. You go to a cardiology lecture, they'll talk for hours, and they'll never talk about nutrition, even though nutrition is the most important thing in the health of the heart by far, by a factor of 100. Okay, so what's a couple points? How come they don't ever talk about, why not talk about exercise to cause mitochondrial biogenesis and neurogenesis? Why not talk about low-fat, low-sodium vegan diet to optimize blood flow? Organic vegan to avoid pesticides, which are mitochondrial toxic. Sunshine, you get more vasodilatation through increased nitric oxide precursors. Warmth also lowers blood viscosity, so it makes it flow better. Antioxidants are present in a plant diet to optimize neuroprotection, plus all the potassium and magnesium one gets, okay? Okay, here's just some references. Plant-based diet recommended for Parkinson's patients. Whole bunch of articles on Parkinson's and diabetes. Having diabetes increases your risk of Parkinson's. And like I said, it reminds me of the mechanism in the hippocampus. They both got glucose type 4 transporters, meaning that they're insulin-dependent glucose transporters. So they're both going to suffer with insulin resistance and being less able to get glucose into their cells. And now here they are. They got millions of mitochondria, and they need glucose to burn. They need oxygen to combine the process to make ATP. Each one can have 1 million synapses. They need tons of energy. You have to optimize things to keep those neurons alive. Neuron doesn't get enough energy. It goes into programmed cell death, apoptosis. And the more neurons they lose, the more they go down the tubes physically and mentally. Okay. We talked about galactosemia, the milk sugar. Okay, and that's about it. Hope that was helpful.